Everybody. How's it going? My name's Jeremy. Jeremy Grossman. I'm a doctor out in New York right now, a resident physician. I'm a second year in a 4-year program. So I know where all y'all are at, whether you're in high school, college, etc. I've been where you've been, and it's tough and it's stressful and it's scary, but it's very exciting, and you've got your whole future ahead of you. So kind of my goal for today is to expose you to kind of the insider side of the field and from my personal experiences, and I'm all about being honest. I've done a few talks with a few hundred people. I've done a few talks with much less than that. This is like only a few of us. So if you guys want to make this more of a group discussion, I encourage you to turn your cameras on, turn your mics on, and we can all just kind of make this a discussion because there's so few of us. But other than that, I do have a presentation, and I'll go through it, but like I want you guys I don't know if they have their mics activated, but you guys can just speak up and ask questions. And if Pemba, if there gets to be too many people, obviously you can mute them or whatever you got to do. But I just want to make this for you guys, because this is not really a big presentation that needs to be like so formal. Okay. So I don't know how to use this, so that's why I messed up when you guys first walked in. So let me see. I click. Okay, so that means next slide. Okay, so I clearly put a Q&A here. So I'll just give you the background for what I'm doing. So I grew up in California. I went to University of California, Irvine, where I got degrees, undergraduate degrees in biology and psychology. I don't think that's normal. I just did that because I had issues determining what I wanted to do, and I was thinking about being a therapist to some degree as well. So that's why I did that. Most people have one degree, and that's 100% fine. I then went on, took a year off. I did some teaching. I did some MCAT studying, and eventually got into a place called the Sackler School of Medicine, which is in Tel Aviv, Israel. And it is a New York State boarded school. So it's not like a US accredited, but it's a New York State school. So basically what happens is the state of New York recognizes us and takes us in, and we do residency for the most part in the state of New York, but we really can go anywhere in the country if we wanted to. So I ended up at a hospital in Long Island. So I'm doing a residency in combined residency, just like my undergrad, 2 different ones: internal medicine and pediatrics, and I love it. Having a good time. I'm in my 2nd year out of 4, and yeah, it's a good time. So I can answer questions rather about med peds, which is what I do, or about medicine alone, or about pediatrics alone, or really about anything you guys want, right? So your guys' next step is probably either college or medical school, so I can answer questions about those specific things as well, because that's what's next in your life. And I think most importantly, I'm here to give you guys tips on what I think is really important to do as a pre-med, and determining kind of what it's going to look good on your apps, what's going to be helpful in exposing you to the field of medicine, and potentially for you to determine, again, this is like my biggest goal, is to determine if you guys want to really do medicine, right? Because it's a really big field. And a lot of people, we put pressures on ourselves to do medicine. A lot of other people put pressures on us to do medicine. And we have to determine if it's really right for us. And ultimately, there's a lot of fields out there that you can give back to the world, and it doesn't have to be medicine. So you should really be going into this field if it's really what you're passionate about and what you want to do. And hopefully that's what we can determine today. Okay. So a little bit about me: I'm a senior resident. So, the first year of residency, you're an intern and you're really just learning the ropes of being a doctor. So beyond that, 2nd, 3rd, 4th, 5th, 6th year, depending on how long your residency is, you're learning how to be, you're teaching a lot, and you're perfecting and honing your skills of being an attending. So I'm a 2nd year, and in about 2 months, I'll be a senior, or rather a 3rd year. So I'll be 3/4 the way done soon. As I said, I'm a specialist in internal medicine and pediatrics. So I work with adults and kids, and I specialize in the acute inpatient hospital setting. Some people compare us to like family medical doctors. Family medical doctors are more outpatient medicine, and it tends to be a little bit more outpatient centered, but family medical doctors can still do inpatient medicine as well. They are, however, weaker in the field of pediatrics and can't really practice that solely. They also lack the opportunity to go into as many specialties, right? So if I want to be a cardiologist, I can do that. Through family medicine, you can't really do that. And I can go into a combined med peds fellowship. I can go into an adult medicine fellowship, or I can go to a peds medicine fellowship, and I can really do anything I want. For me personally, I want to be a hospitalist, work in the hospital with adults and kids, and just see a breadth and depth of conditions and work with everybody and have a good time. I don't necessarily want to specialize in one field because, frankly, that's boring to me. Interesting fun qualities. I got a dog, Zeus. That's a picture of him right there. He's obviously cute. Objectively, nobody disagree with me. I play guitar, and I guess I wrote that I love watches. And I still need to take that out. I need to take that out of that presentation. That's so like insignificant. Anyways, moving on. How I got here. So I grew up in SoCal, Southern California, and I'm a type 1 diabetic. So ultimately, I've been in and out of the medicine field for, my entire life. So that kind of drove me to go into it, and it kind of made sense for me to go into it. But obviously you can have your own reasons and wants and needs as to why you're going into medicine. It doesn't have to be that you have a condition, right? I told you I went to college at University of California in Irvine, went to medical school at Sackler. And my current program is 4 years long. I'm training with adults and kids in the hospital setting, and I can really go off and be any kind of specialist I want, but I'm choosing to be a generalist because I find it the most interesting, the most diverse, and the most fun for me personally. Why medicine? Kind of told you I'm a diabetic. I really enjoy helping other people out because I have like a lot of personal experience working with a disease and living with it. And so I think I associate really well with my patients and I can help them out quite a bit. Again, everyone has their own reasons to going into the field. And again, I want to open up the floor and throughout this presentation and you guys can share with me what your thoughts are and why you're going into the field. And if you have any questions or concerns, please interrupt me at any time. Okay. There's this really cool organization called NAMPRA, which is the National Med Peds Resident Association. And at NAMPRA, you basically can look up everything about med peds, why you would want to go in the field, what your options are, what your benefits are, what your obstacles are, the kind of board certifications you want to go into, and the type of things that you're going to see as a med peds doctor. For most people, I recommend aafp.org, American Association of Family Practitioners. That's going to expose you to everything. Family medicine, I think, is a great, amazing field because it's like all of medical school wrapped in one bunch. You get surgery, you get OB-GYN, you get medicine, you get peds, you get neurology, you get everything. And it's a great way to introduce yourself. So I always recommend to medical students that I'm mentoring to make sure to shadow, and more so shadow with a family doctor, because I think it's going to expose you well. Even if you want to be a surgeon, even if you want to be a dermatologist, whatever you want to do, I would recommend starting out with family medicine because it really exposes you to the field of medicine, and you need to have a basis before you go on to being a specialist in any field. Okay. So a med peds doc. So as I said, it's a combination of pediatrics and medicine. I'm getting double board certified. So what does that mean? That means I can do either field and I can do the specialties of either field, in opposition to family medicine, which is pretty limited as to just being a family medical doc with some specialties. I literally see any illness, surgical and medical. I deal with anything and everything. And I love the fact that anything that could walk in the door is something that I can deal with and I'm confident in dealing with. And most importantly, when I'm not confident in dealing with it, I'm going to speak to somebody who will know, and I'll be able to get that advice. And then from that encounter, I'll learn how to deal with it and hopefully be able to take care of it on my own. And obviously the field of medicine is changing constantly. You have to read up on things. So it's super important to make sure to know what your limitations are and how to respond to that. So this is a really good chart. This is basically talking about your kind of like your outlook in the next 10 years. This is really overwhelming. I tell everyone, all the students that I mentor, to say, listen, you have to really just look 1 week in advance at a time. If you look more than that, it's going to be overwhelming. Okay. Undergraduate, you guys are probably, most of you are in undergraduate education. It's about 4 years, right? Unless you're super smart, you do it in 3 years. Good for you. That's awesome. But for most people, it's 4 years. Okay. And after that, or during, you're going to have to take your MCATs, right? And so you see that MCAT test there. That's going to get you into medical school. The first 2 years are going to be mostly in the classroom, and the last 2 years are going to be really on the floors, working with patients, and getting that kind of like on the job training as a doctor. After that, you take your USMLEs and go into residency. I think here it says 2 years. It's really usually 3 to 6 or 7 years, depending on what you go into. And then after that, you have fellowship if you really want to specialize in something. So it's a really long path, and you have to be you have to be cognizant of, listen, I'm not getting in. If I just want to be a doctor, it's not just undergrad in med school, it's also a residency on top of it. And then if you want to specialize on top of that, it's another 3 to 4 to 5 years, right? So you have to keep all of this in your mind. And I don't say that to scare you, but you really have to keep all of this in mind, because what you're getting into is a really lifelong thing, and you have to really be passionate about it. Just because your mom or your dad or your guardian or whoever wants you to go into it, or you feel the need to go into it, or you like the prestige, you like the money, it's not worth it for that. It's really not worth it. And I can tell you firsthand, like that, it's not Grey's Anatomy, it's not Scrubs. What you're doing in life as a doctor is really a lot of paperwork, a lot of thinking. It's a lot of hard work. It's really rigorous. It's long hours. But if you love what you're doing, it's not going to be work. I love what I'm doing. I'm really grateful that I do love what I'm doing. And that's why I recommend everyone to shadow. Shadowing is super important. I mean, obviously during COVID, this is really great. You have virtual shadowing opportunities, but now's the time. COVID's starting to clear up a bit, that you can go out there and potentially get some experience shadowing. So the way I recommend you shadow is not to do programs. I did a program at a hospital and it was terrible. All they had me do was get towels and drinks for patients. It was horrible. What you should do is go online, type in family doctor near me or dermatologist near me, whatever, on Google, find those numbers, call them, email them, whatever you got to do. Say, I'm a student. I would love to shadow you. Please, if there's any time to come by, I would love to do it. And you'll email, let's say 10 people, and maybe 1 out of 10 responds, and you go to that 1 out of 10, and you've got an in. That's going to be awesome for you. That's what I recommend. That's what I did. And I was lucky enough to figure that out on my own. And I had a great response to it, and I learned a lot. And I'm still in talks with that doctor that I work with today, and really value the time that I had with him. Okay. So typical day in the life. This is very interesting because I think I didn't know this as a pre-med. Essentially, you wake up, let's say 5 a.m. I have a dog, Zeus. I got to walk my dog, Zeus. I want to have breakfast. I want to have coffee. Then I go in around 7 a.m. Okay. And I'll get sign up from the night team. The night team is there. They interact with all the patients. They respond to things, and they sign out anything that happens. So Mr. Johnson had a heart attack, and we sent him to the cardiology floor. Mr. Bobby Jacobs had a headache, so you give him Tylenol, blah, 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 blah. They tell you everything. You write it down, and then you get ready for rounds. So from 7 to 9 a.m., roughly, you're going to be looking at your patients, making plans, thinking about what's the best for your patients, and potentially getting ready to discharge some patients that are leaving. 9 a.m., your attending physician, your head honcho physician comes around, and you're going to work with them, and you're going to present your patients to them and say, I want to do this. And your attending is going to say, well, I like that, or well, I don't like that. I'd rather do this. And you make a plan for each of your patients. And that goes on for a few hours. Around 12, you get lunch. In the afternoon, you get hopefully some food. You meet up with a friend or two, do some of your work, write some of your notes. And then 7 p.m., you sign out and to the night team. And then as the night doc, they do what they do. You come back and you do the same thing over and over again. And that's like 6 days a week. You have to realize what you're doing. You're there for 13, 14 hours a day, 6 days a week. That's a lot of time. You really got to like what you're doing. If you don't like what you're doing, and you want to just make money, like go into business, go do something else. This is not the place for business. This is like hard work. You really got to love what you're doing. It's a lot of repetition. I'm seeing the same stuff every day. I'm writing Tylenol orders 50 times a day. I'm writing fluid orders 50 times a day. You got to love the repetition. You got to love the thinking. You got to love the clinical aspect of it, because it's not an easy job, and you're really working for your money. Okay. All right. Right now, I'll take a time. Does anyone have any questions? I see some names. I see Bella. I see Sam. I see Jayri. I see an R. I see Emily, Maria, Hannah, Jennifer, Miriam, Melissa, Yuna. A lot of people joined. ZU, Sarah, Jasmine, Farah. Another Farah? There's 2 Farahs? I'd assume they're the same person. And Danica. Do any of you guys have any questions at all? If you don't, it's okay. I can just keep talking.
If they have questions, they usually drop it in the chat box.
Okay, do we have anything in the chat box?
Not yet. But I'll let you know.
So maybe that's good. Maybe I'm answering questions or maybe they're bored. I don't know yet. We'll find out.
Oh, I have a question from Miriam.
Okay.
Do you have any tips for students shadowing to make a good impression?
Make a good. Honestly, guys, doctors don't just want to see you be interested. They don't expect you to know everything or do anything. Like, just act interested. Ask questions. Be interested. And if you're not interested, shadow somebody else, or maybe say, maybe I'm not interested in this. Maybe it's not what I'm doing, right? So just be interested. Ask questions. Follow them around. Don't like zone out and like text on your phone. That's all you got to do. Just be super nice. Be friendly. That's all you got to do. Shadowing is like pretty much what it says. You're just shadowing someone. You're in their shadow, listening, watching, waiting, figuring out what they're doing, and figuring out if that's what you want to do. You really got to spend a lot of time in this field to see exactly what they're doing. And that's why they ask for like how many hours, 200 shadowing hours they want, something crazy like that. That's why they want you, because they want you to really determine you're getting in, because you're in it for like 8 years, 9 years, 10 years, even more. So you got to really determine if it's what you want to do. So just be nice, just be kind and act interested. Anything else?
I have a couple questions about tips for medical school and undergrad. Do you want to wait till the end of the presentation?
Let's do it. Let's do it. I want to make it about you guys. I want to answer the questions.
Okay. So Eunice asks, how do you prevent burnout in undergrad and medical school?
Oh my gosh. Yeah, that's tough. That's super tough. I mean, I was in a society that like we would have fun in the weekends and we would go out and go to restaurants, go to bars, whatever, and have fun. That's super important. And in order to do that, you need to set out time for your week. You need to say, okay, Monday, this time I'm doing this. You need to set out. You need to plan out your week and say, okay, these times I'm going to do this. These times I'm going to do this. And obviously, it doesn't always go the way that you planned, but ultimately you got to do that. And once you get into that vibe of constantly planning out your week, you're just going to set up yourself for success later down the road. Because ultimately, you're gonna have so much going on as a pre-med student, as a med student, as a doctor, that you gotta plan everything out. There's no time to just like dilly-dally and just do stuff on the fly. There's so much going on. So plan your week out so that you can enjoy it, right? Because if you planned out, I'm gonna do all this all day and from 7 to 9 p.m. I'm gonna go have fun with my friends, you're gonna enjoy those 2 hours because you know that you plan those 2 hours out and you're gonna take care of the work you do at a later time, right? So that's a good thing. I think when you're studying, to have a plan, always have a plan as to how you're studying or a format. So the way I studied when I was in classes was you usually have one textbook. I would limit to the minimum amount of textbooks you can have. That's going to allow you to pass the class and say, okay, so I have this textbook. I'm going to go through it and I'm going to highlight everything that's important. And I'm not going to read through that textbook again. I'm only going to, when I go back to this textbook, I'm going to only read the highlighted stuff. So essentially you're cutting that textbook in half or in a quarter. So you're only reading the important stuff. Okay. So that's going to prevent burnout, right? Because if you just keep reading the whole chapter multiple times, that's cuckoo loco. You're not going to be able to function. I mean, that's so much time. I interact with so many students that do that. You got to write notes. The first time, go through it one time and write your notes. So whether you're highlighting or writing down the important stuff, that's perfect, right? So if they say like the ant is an insect, you already know that. Don't write that down. Don't highlight that. Leave that in the book. Don't read that again. Write down the stuff in between that's important, right? So those are 2 little facts. Hopefully that answered some of what they were asking. Other questions?
I have a couple more questions.
Yeah.
So Sam asks, what is a good way to stand out when applying to med school or when you're interviewing?
That's the golden question, right? That's a really good question. Med schools really want good grades and they want good MCAT scores. I think everyone knows that. If you don't have that, that doesn't mean you won't be getting in, but it's going to mean that you need to show a lot more on your application. So whether that's volunteering, whether that's other academic things like research, or taking other classes, whatever it is, you're going to need to show that. Shadowing is great, but just shadowing is like, okay, you shadowed, everyone shadows, so what? Do something meaningful that you're interested in, right? So I did a lot of homeless work. I would just go out and just give food to the homeless. And I even like just took surveys. How did they end up homeless? And I put that on my resume and it looks so good. Wow. You not only fed and helped the homeless and you did a regular schedule, you did it once a month. Doesn't matter if you do it like, if you do it for a week versus once a month for 4 years or 3 years, that's like way more important. That continuity is way more important than doing it for like 12 hours a day for 7 days a week. Like that's just a little chunk. That doesn't really show me much. So that continuity is really important. What else? Grades are really important. And on this note, I will say the following. I went to an international med school that, by chance has affiliations with New York. Great. But I know so many people who say I'm too good for DO, I'm too good for international. Then you don't really deserve to be a doctor. If you don't get into a US MD school, then you don't deserve to be a doctor, to be honest. If you're just into prestige, I don't want you in my field taking care of patients because you're just in it for yourself, you're in it for the money. If you really want to be a doctor and your application is not strong enough and you know it, but you know that it's what you want to do, please apply to Caribbean schools, please apply to international schools, please apply to DO schools. You still make great doctors. It does not have anything to do with where you went to medical school. And I guarantee you, your patients do not give a flying F where you went to medical school. All they care about is that you're a good doctor, you care about them, and you know what you're talking about. And you know better than anyone else if you're going to go up and study and learn your craft and work really hard and make it an effort to have a positive impact on your patients. More questions?
Mhm. So Maria is, hold on, that's another question. Sorry.
It's okay.
Oh yeah, does being a medical scribe count towards shadowing, or is it just seen as clinical experience?
I think it does. I think it does count as shadowing. I wouldn't quote me on that. I think it does count as shadowing because you are shadowing, and on top of it, you're scribing everything you're doing. So I'd imagine it does. I would only scribe if you have an interest in it. If you have some sort of financial responsibility and you could make more money flipping burgers at Denny's, and then on the side doing volunteering, or rather shadowing for free, I would do that. I wouldn't necessarily scribe or EMT just for the fact that it looks good, because I don't think it looks necessarily that much better. I think what looks really important is that you have meaningful experiences that you can talk about and potentially present on your application. I think that's more important.
Another question from Bella. How many students were in your program, and was it the perfect amount of good learning experience?
Yeah, good question. Before I answer that, I just want to say too, on my Instagram, guys, if I don't answer your questions today, please add me. It's Jeremy Grossman _, and I answer all of the questions you guys send me. So please reach out if I don't answer any of your questions today, or if you think of more. Okay. Now about your question, class size, I don't think it matters much. When you get to medical school, you get to a certain point where you have to teach yourself. People aren't just going to silver platter everything to you like they do in medical school and high school. You need to go on your own accord and learn the information. So you're going to have textbooks and study books and manuals that are going to be passed down from older generations of med students that you're going to study. And that's going to be it. You're going to have to study. And when you don't know, or if you can't figure it out, you'll go to a peer. When you can't figure out your peer, maybe you'll go to study hour app with a professor and figure out what's going on. I don't think the class size matters so much as to your personal ability to self-teach. Now, as far as a social aspect, sure, yeah, like more students could be fun. You can go out, have fun, more people to meet, but I'm not sure that's what this student was talking about. Any more?
One last question from
Okay.
Yuna. So she says, is it rude to stop shadowing a doctor after a few days if you're not interested anymore?
No,
And
dip
what
out.
kind of
Dip
something
out.
else?
It's not worth it. No, dip out. If you're not getting anything from it, dip out. I stayed with one for like 6 months and it was terrible, and doesn't matter.
So
Just
there's
don't
no
put money
recommended
out.
number of hours you need to shadow them for before you quit?
Sorry?
Is there recommended number of hours you?
Get out. Say, listen, like, I really appreciate your time. Unfortunately, I'm unable to shadow you at this point in time, but I wish you the best of luck and thank you so much for the opportunity. Done. Zip out. Go email somebody else. Don't keep shadowing somebody who's not going to give make a positive impact on your career.
And if there's a specific experience that made you want to do medicine 100%?
like internal medicine or medicine?
Just medicine in general.
I mean, it was really just having type 1 diabetes and being in the field, and like nothing else made sense to me. But everyone's going to have their own experience as to why they want to go into it. The recommendations I don't want you to go into it is prestige, money, or anything like that, like something that's not really genuine. You should really go into it if you want to help patients, if you really enjoy what you're doing, and if you enjoy the mental clinical aspect of medicine, of of what you're practicing.
Yeah, I think that was it for the questions. Thank you for taking time for
Yeah, of course. All right, so I talked about this stuff. Let's go to the next one. All right, so we did Q&A. Okay, let's talk about a case on the floor. Does anyone have any other questions, like for general? Because now I'm just going to do a case because I do this with all the shadowing sessions. Any other questions popped up?
Nope, not yet.
Okay.
We can just go into the case, yeah.
Cool. So we'll just talk about a case, okay? So it's a 14-year-old male. He comes into our ER and he's had a fever for 20 days, which is a really long time. If you had a fever for 5 days, you can have a virus or something like that, but 20 days is a really long time. So the 14-year-old kiddo is coming in for a long time of fever. They're every day, they're usually at nighttime, and they go as high as 103 degrees Fahrenheit, which is pretty high. He's had some night sweats, he's had a headache, malaise. Anyone know what malaise is? I'll leave the chat open. Who knows what malaise is? Nobody? Anybody? Oh, we got some shy people. They're okay to ask. Oh, generally feeling bad. Thank you. Yes, just weakness. Ooh, how do I go back? There we go. Good. Yeah, generally feeling weakness. Thank you. Very good. Anorexia, which is not anorexia nervosa, which is like the condition you think of. Anorexia just means you don't want to eat. You don't have an appetite. Weight loss, diarrhea, and non-bloody slash non-mucousy stools. Okay, that's important because some stool patterns with diarrhea can cause bloodiness or mucus. He's been taking Tylenol, which has helped. Okay, awesome. He's had some help with taking Tylenol. That's good. It's an antipyretic. It's an anti-fever medication. He's had some symptoms after returning from a 2-month trip to Pakistan. Very important, right? Travel history is very important, right? Because they have a lot of different conditions over there that are not present here. So maybe he got something over there, right? He saw his PMD, which is a primary medical doctor, primary care physician, about a week ago. And he got a 10-day course of amoxicillin for strep throat. All right, so he had some sore throat and they thought he had a bacterial infection, so he got some strep throat. Okay, sounds good. So a review of systems is something we do. So I, as a doctor, I'm going to ask my patients questions every day. The same questions I ask pretty much all my patients. I say, do you have this? Do you have this? Do you have this? But ultimately, I'm going to forget some stuff. So I need to do a formal review of systems. So this is my formal review of systems that I ask all my patients. And what's in red is what he told me on top of what I usually asked him. So we covered most of what's on here. But he also added that he had a headache and a cough. Okay. He didn't have any nasal congestion, no sore throat, no joint pain, right? So there's pertinent positives, what he does have, and there's pertinent negatives, what he doesn't have, right? Because that'll lead you down a certain path of what conditions you're thinking of. So these are his vital signs. Can I have somebody tell me what vital signs are sticking out? Obviously, some are in red, but can somebody tell me which ones are worrying to me? It looks like Sam messaged me. He's a type 1 diabetic. Sam, add me on Instagram, bro. We'll talk. Yeah, you can 100% do those things, but we'll talk about privately how you deal with those. Okay. Bella can't unmute ourselves. Okay, so just text in the chat. It's okay. So Miriam, heart rate looks high. Yeah, the heart rate does look high. A normal heart rate is 60 to 90. He's tachycardic and hypotensive. Okay, J-Ree, if I'm saying that right, she's using some very scientific terms there. Very smart. Tachycardia, low blood pressure. Very good. We call that hypotension, is low blood pressure. Yeah, exactly. So hypertension is super scary to me. If somebody doesn't have good blood pressure, that means their organs are not getting good perfusion, and that could be really bad. Like you could die fairly quickly with low blood pressure. So that's something that scares me. The tachycardia is just actually a response to low blood pressure, right? So if our arterioles, if our arteries are slogging, they're really slow, I have less flow. If I clamp down, for those of you who've taken physiology, the blood's going to shoot out faster, right? If I hold a hose and I put my hand over the hose, I decrease the hole size and more blood flows, right? But if I open it up, that's kind of what happens with low blood pressure. It opens up that hole and there's less flow, it's slower. So my organs are not getting good perfusion. So the way my heart responds to that is it beats faster so that more blood can flush through that hole. Okay, so that's why you have tachycardia. He also has a temperature of 38.1, which is obviously in Celsius, right? So a 38 temperature is high. You want to be usually around like 37, a little under that, okay? Less than, I think, 37.8, 37.7 rather is normal, okay? And his pulse ox is normal, right? So pulse ox is just looking at the saturation of oxygen in your blood to make sure, is there enough oxygen in your blood? And ultimately this kiddo had enough oxygen, okay? So now we look at the physical exam. Every time you go into a patient room, you want to look at their general appearance, right? Do they look in distress? This kid looked fine, okay? I looked at his eyes. Were they moving right? Were they the right color? I looked at his throat. I looked at his ears. I looked at everything to make sure that everything looked okay. No obvious signs of infection, right? He's had a fever for 20 days, so I have to look for these signs of the fever, right? Respiratory wise, I'm listening to his lungs, making sure that everything sounds clear. There's no gunkiness. Maybe there's an infection or pneumonia, or there's extra air in there that's pushing on the lungs. I have to make sure everything's okay, right? I also have to listen to his heart, right? Sometimes you can have infections of your heart that can cause really long time fevers. So I had to listen to that. I didn't hear any murmurs. Murmurs are just weird sounds in the heart that are not normal. Normal heart sound should go right, boom, 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 right? A murmur might sound like boom, 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 right? Kind of a weird sound like that. So I'm listening for that. And so I look at his gastrointestinal system. I'm feeling his abdomen. Is it tender? Is he in pain? Do I hear bowel sounds with my stethoscope? Is his bowel sounds like they're moving normally? And they were. I check his muscles. I check his joints. Everything was okay. I looked at his skin. There was no rashes. Looked normal color to me. I checked his neurological status. He seemed with it to me. He seemed like he had good sensation, good motor control. Everything was okay. And then psychiatrically, is he okay? Does he feel okay, right? Some people who are really sick will be super confused. So he was okay. He was cooperative and he had, appropriate mood and affect is what we call it. Any questions so far?
Like
Nope.
just
Okay.
yeah, nothing yet.
Nothing yet. Yeah, I got the chat up now too, so I'm giving people a second. Okay. So what is the medical term for what this patient is experiencing? So I'll give you a hint. There's a fever. We don't know where it's coming from, and it's been greater than a week. There's a medical term for it, and it's super basic. It doesn't sound scientific at all. Let's see if someone can guess it. Sepsis. Okay. Good guess. Good guess. Okay. All right. Sepsis. Shock. Okay. Maybe septic shock. Okay. So this patient's been experiencing what we just call a fever of unknown origin, which just means that we don't know where it's coming from. It's been for about a week, right? Because anything under a week is not really scary to me, right? Because you can just have a virus and it can be for a few days and I'm not going to call it anything. Sometimes we just, as doctors, we don't know what the fever is from, but as long as it goes away and you feel better, then we can say, okay, I'm not really worried about it. It was clearly something we just never figured out and it was probably some infection and it resolved, right? This one's been going on for greater than a week. And here's a nice funny joke. Oh, you said FUO and not UFO. Fever of unknown origin versus a UFO. I thought it was funny. You guys are a tough crowd. I can't see you laughing or making noise. That's okay. All right. What could some of your differential diagnoses be? I want everyone to answer. What could be a cause of a fever for 20 days? And there's no wrong answers here because you're all pre-med and you haven't been trained in this. So I want an answer from everybody. Parasite. Good. It could be a parasite. 100%. Good job, Sarah. All right. Emily also thinks it's a parasite. Everyone thinks it's a parasite. Delayed laughing to joke. Delayed laughing to joke. Okay. I don't get it, but I'm sure it's very funny. Infection. Yeah, it could be infection. Yeah. Oh, delayed laughing to my joke. Thank you. UFO joke. Thank you, Bella. Very good. Immune disorder, 100%. It could be an immune disorder. Definitely. Good job. You guys are killing it. You guys are smart. Most people didn't get this in my last lecture. I had like 600 people. A bug bite, sure. Maybe a bug bite from a mosquito, sure. A viral infection, 100%. Eunice, good job. 100%. Could be a viral infection. Give me something else, guys. I need 2 or 3 more. I think there's more of you in here. An amoeba, right? An amoeba. Okay, it's a very interesting. What is an amoeba? Is that a parasite or a fungi? What is that? What's an amoeba? I haven't heard of the term amoeba since I was a bio student. I think it's a parasite. I could be wrong. What is an amoeba? Is it a fungi or a parasite? We don't even use that word.
Fungi.
Is it a fungi?
I don't think it's a parasite. I
Okay,
don't know.
you might be right. I think it is. He just got his COVID vaccine. Okay, yeah, it could be that, Jerry. So stress, embolism, yeah, a pulmonary embolism could cause a fever. Damn, you guys are really smart. Are you guys all? Are any of you in med school? It's like next level. UTI, yes. Okay, you guys got it all. I'm done. You guys are making me look bad. You guys are actually really getting it. This is like the most. This is crazy. This is like the most interaction I've had in one of these. Good job. So here's your differential, guys. You can break it down into a lot of different things, right? Is it an infection? Is it a neoplasm, which is another word for a malignancy, like a cancer, right? Is it autoimmune, somebody said, right? Is it like a lupus, sarcoidosis? Probably you haven't heard of that before. Is it bacterial, right? Is it an endocarditis, a heart infection? Is it Lyme disease, right? Bitten by a tick? Is it a virus? Is it a fungus? Is it an amoeba? That's crazy. That's really funny. So it can be a lot of different things. And as doctors, we have to say, okay, we have to go down each of these paths and say, what's the probability of this? And do we want to go down and spend the money and test this, right? Because it's not only testing, but it's also thinking about the cost efficiency of what you're doing, right? All right. So as the ER doctor on call, what do you want to do? I'm going to remind you, and again, I want everyone to participate. Low blood pressure, maybe an infection, maybe not, I don't know. And he has a fever. What do we want to do? Amoeba is a pseudopod. Okay, Pemba, very good. All right, so what are we doing, guys? What are we doing for this person? He's in the ER. Fluid, boom, I love it. Low blood pressure, give him fluid. Very good. You guys are really smart. What else? All right, so we took care of the low blood pressure. What are we doing for the fever? What are we doing for the fever? Come on, this is an easy one. Tylenol, thank you. And what are we doing for the possible infection? What are we thinking about? Antibiotics, yeah. Yeah, everyone says antibiotics, good job. Broad spectrum antibiotics that are gonna cover most bugs because we don't know what the heck this person has, but we know that they might have an infection. So even though it might be something else, they might have an infection. So let's give them an antibiotic like right now. So we did do that, okay? So before we talk about what we actually did for this patient, you have to talk about, as an ER doctor, what are you gonna do? Are you gonna send this patient home and have them see a doctor tomorrow and help them out now and just kind of tidy them up? Or does this patient need to be watched overnight? Does this patient need to be in the hospital managed because they're at really risk for dying, right? So there's different criteria for figuring out what they need to do. So you need to run lab tests, you need to do imaging, and you need to just generally look at them. Do they look really sick and ill? Do they look like they can't function, right? If they can't take down any fluids or food, you got to take them in because they're going to need IV fluids. You can't give somebody IV fluids at the house. You got to do that at the hospital, right? So this kiddo is definitely going to need to be admitted. Okay. So looks like we looked at some of the labs here. And there's a lot going on here. I'm not going to go into it because you guys are all pre-med. But essentially what we saw was his liver. Some of his liver enzymes are elevated, meaning there's some liver injury. His creatinine is elevated, meaning he has some kidney injury. And his sodium is low, meaning he's dehydrated potentially, okay? But what's most important is that his white blood cell count, right? The cells that fight infection was normal. So that was like, that's confusing. If he has an infection, shouldn't those white blood cells be higher to fight the infection? Anyways, we'll go into that later. We'll figure out what happened. Here's some other labs. The left side, don't worry about too much. The right side, this is a general viral swab where we can quick check to see if anyone has any viral illnesses right off the bat. Looks like everything was negative. Even the bottom one there, which is COVID-19. You guys probably heard of that before, right? And this guy had none of it. So we were like really scratching our heads. He's got no white count. He's got a fever for 20 days. And his virus panel is like, what the hell is going on with this guy? What in the world is going on? Here's his chest x-ray. Can you guys see my mouse? Oh, you can? This whole time I didn't know. So let me see. I got to move this guy here. So this is a heart. Okay, this is the heart clearly, and it looks normal to me. A normal heart, the span of it should be less than the span of this half of the chest. So if you take it, it's probably about this far. Okay, so it's a normal heart. You look at the air here. You see it, everything looks mostly normal. Mostly normal here. There's little markings. This is all pulmonary circulation. Blood vessels and whatnot, and that's pretty normal. You look at the diaphragms here; those are nice and curved. You look to see that this is the trachea, right, the airway from your throat. This looks normal, mostly central. Okay, and then you look at all the bones. Are there any fractures? Anything else going on? You can have a kind of a look at kind of everything, and everything looks pretty normal to me. It was a little hazy here, so I said, maybe there's something. But the radiologist, who's the professional at reading these images, said it was nothing. All right, so we talked about what does this patient need, and you guys got it. You guys were really good. He needs fluids, he needs Tylenol, and he needs antibiotics. So we chose ceftriaxone here, and I'll go into a little bit about why a little later. Okay. So we did choose to admit him because he needed those fluids and antibiotics, right? And eventually we grew blood cultures from this guy, and they grew out to be salmonella. Maybe you guys have heard of that before. Salmonella is a bug that your mom or your dad probably said, cook that chicken more. You need to cook that chicken because you're going to get salmonella. So that's what this kiddo had, okay? It's an enteric fever, meaning a fever that's coming from the abdomen. And you can get it from eating certain foods, from drinking certain water, and sometimes interacting with animals too. You can see from the chart on the right. Usually you get it as a kiddo or a young adult more often. In older people, it's less common, probably related to our immune response. But I don't think that answer is quite known. So there's approximately 200 to 300 cases of salmonella a year. So think about it. There's only 6,000 hospitals in the country and only 200 to 300 a year. So I was pretty lucky to have seen this case because it's not a very common condition. A lot of people don't see this. There was someone called Typhoid Mary who was a chronic salmonella carrier. And she was basically, I think, a maid or a cook. And she went from house to house giving this bug off to other people without even knowing about it. So they were unaware that she was giving them this sickness, this gastrointestinal sickness, where you're vomiting, diarrhea, whatever it be, whatever their symptoms were. She was giving it off, and I believe the health agency, the federal government at that time, was trying to stop her, and she just kept working. She was trying to make a living, so who can blame her? But essentially, you normally treat it with a special antibiotic called a fluoroquinolone. Maybe some of you have had it. It's called a ciprofloxacin. And typically you get it in, in more poor areas with poor access to water, sanitation, livestock, etc. And, Pakistan, there are parts of the country that are more impoverished. So he was in these areas, so it likely could have gotten it from there. And they're typically transferred from what we call fecal oral route. So when we have it, we excrete it in our feces, and maybe I'm scratching my butt and I forgot to wash my hands, and I shake somebody's hand, and then they take their hand and they wipe their mouth, and then they get it, and that's how they get the bug, right? So that's why we always washing our hands and being sanitary is very important. Okay. So it usually lasts 5 to 21 days. You have this fever, so he fit right into that time zone. And usually the more bugs that you absorb through that fecal oral route, the more chance that you're going to get this disease, the less chance if you take in less of those bugs, if you get less of an exposure. There's different stages of the illness, week 1, 2, 3, and 4. And 4 is usually the worst, where you can have like a perforation of your gastrointestinal tract. And that can lead to something really scary. And, you can have a septic and a sepsis and a septic shock, like some of you guys have said, and what we call a peritonitis, which is a really, really dangerous infection of the abdomen that usually requires surgical intervention. So we got to, as general medical doctors, we have to really be careful about what we're doing in terms of treatment, because we don't want to have this kid have to go to surgery and potentially die. This is a cool physical exam finding. You see some speckled red around the chest, and that's just some interesting findings that you get having salmonella. Our kiddo didn't have that, but I thought it was interesting to show. All right, so some lab findings. So if you remember correctly, our lab findings were normal, but typically, in salmonella, you can have a leukopenia, a low blood count, or a leukocytosis, a high white blood cell count. So he had neither, so he really confused us. You can also get a transaminitis, which is essentially when you get elevated liver function tests, which he did have. So, but that's confusing, right? Because you can get that with viruses, you can get that with autoimmune diseases. So you have to take all these lab findings and really determine using your best clinical judgment what this patient has. Because ultimately, one lab finding is not going to tell you what they have. He also had elevated inflammatory markers. One of them is called CRP, another one's called procalcitonin, but you guys don't have to worry about those. Okay, the best way to diagnose it is by taking a blood culture. So we took this guy's blood and we grew it, and we saw, okay, this guy's grow. We looked at it under a microscope and said, okay, this guy's growing salmonella, so he's got salmonella. And then we shot it with different antibiotics and determined which one killed it the best, and that's how we determined what we were going to give it. Ciprofloxacin, as I said, is like the normal treatment that we do, but in this case, he came from Pakistan, where they use a lot of ciprofloxacin. So essentially, the bug was resistant to it, so we couldn't use it. It learned and it grew and it got exposed to it. So it kind of got smart on us. So we had to pick a better drug, and we went with ceftriaxone. So ceftriaxone is a really strong antibiotic, and that worked. Okay. So thank you so much. That was kind of my case report. I still want to keep the floor open to you guys if you have any specific questions. And as I said, you guys are all, welcome to message me on Instagram. I'm free right now if you guys have any more questions. I know we've still got some time.
Yeah, thank you for that very informative presentation.
Sure.
Yeah. Waiting for questions.
Yeah, if there's no questions, it's all good. If you guys think of them later. How will medical schools view shadowing? So I would assume you mean virtual shadowing. I don't know. I don't know how that's going to work. I mean, so many people did it this year. I'd imagine they're going to be okay with it. Shadowing has never been like a competitive thing that you need to do to look better. It's just been a prerequisite. So I think it will probably be fine. I don't think it will be a big deal. So I think virtual shadowing is great. And to some degree, it's probably better than some of the shadowing you do in person, because you get exposed to so much more medicine. Okay. What do you do if the patient is allergic to a type of antibiotic that is needed to treat them, like Cipro or something? Yeah, that's a really good question, Danica. So basically, you have a huge span of antibiotics, and typical bugs can be treated with multiple different antibiotics. They're not like mutually exclusive to one or the other. So one way you can pick the right antibiotic is by growing a culture and zapping it with different antibiotics and seeing which one killed it the best. Maybe the one that they're allergic to was the best, but you can still pick the second best that killed it and still adequately treat the bug. Okay, so there's always multiple options. Is MedPeds mostly in person or hospital based? In person. MedPeds, well, all medical specialties are in person, probably an exception to like radiology, which you could do from the home. But everything is in person. So MedPeds is more hospital based, and family medicine is more outpatient based. If you have more questions regarding that, please reach out to me on Instagram.
He asked that he meant office-based setting.
Oh, office-based. Yeah. So as I said, family medicine is more office-based, and MedPeds is more inpatient-based. But both can be the other. It's just primarily what you get training in. How has COVID changed your daily work? I think last year, it was terrible. I was just working in ICUs and step down intensive care units, working with COVID patients, and that's all I was seeing for a very long time. And ultimately now, as it's calmed down and vaccination rates have gone up, you're seeing a lot more of the old conditions that you saw, but in the same respect, you're always thinking about COVID. Could this person have COVID? So they probably have a urinary tract infection, but could they also have COVID, right? So you're testing basically everyone that comes into your hospital, you have to test for COVID because it's so common, right? Have you ever considered dentistry or pharmacy? I think those are both like amazing fields. Dentistry, it's very much a hands-on job. It's very much a physically demanding job. I think you make generally a lot more than most physicians do as a dentist because of the procedural work you do. Pharmacy, I think, is amazing. They're very smart people. It wasn't for me. It's a lot of office kind of work. There's a little bit of patient interaction, but it's not to the degree that I wanted to have it be. Again, reach out to me on Instagram if you have more questions about those in specifics. Jayri, okay, I'm in office based setting. Emily, I just want to tell you this has been the best virtual shadowing I've attended. Thank you. Oh, Emily, you're the best. That's very kind of you. Emily, reach out to me if you have questions, okay? Jennifer, did you consider any other specialty other than pediatrics? So I considered family medicine. How did you come to your decision to specialize in pediatrics? So it's not just pediatrics, right, Jennifer? I'm doing adult medicine and pediatrics. It's a super specialized, weird field. Most people just pick one. I have issues with choosing things, so I picked both. Okay, but I was always into doing general practice medicine. I want to be the primary caregiver of the patient and me making all the decisions. As a surgeon, for example, if I'm consulted, I'm just dealing with their little surgical problem, and I'm not dealing with the person as a whole. So it was always meant for me, but you have to determine what you want out of life, right? Most specialties are, you think about what you're doing physically, but you really got to think about what's going on in here, because everyone's practicing medicine in their brains. Ultimately, everything that you're doing outpatient after a few years gets old. So you got to think about, is what you're doing mentally stimulating you? And that's what's important. Please, again, ask me questions privately about that if you have questions about other fields you're interested in. Miriam, everyone makes mistakes. How do you as a doctor, when the stakes are high, how do you deal with those mistakes and talk to patients about that? Yeah, I mean, that's a huge kind of like buzz talk in medicine right now. Ultimately, you should chalk up to your mistakes and try to fix them. Doctors are people too, nurses are people too, and everyone does make mistakes and they happen, and there are protections and there's malpractice insurance for that. But ultimately, you have to learn from them and use your time as a trainee, as a medical student, as a resident to try to improve your efficiency in not making those mistakes, right? And following protocols. Okay. How do you juggle work-life balance, from Emily? I have a dog at home. I have a lot of friends, and I try to make sure to schedule at least once or twice a week something to do. I'm on Instagram. I like to have fun. Please, again, follow me on Instagram. I like to reach out and talk to people there. I watch YouTube videos. I go on Hulu. I like to go on walks with my dog. I call my family, whatever it is. We're just humans too, and you guys are humans too. And, just try to make sure you're doing what makes you happy. If you like to paint. If you like to draw. If you like to play basketball, go play basketball, and make sure you find time to do it. Again, thinking a week out in advance about what you're doing is really important, and giving yourself time, allotting yourself time, will make you feel a lot less guilty about giving yourself that time, because you're giving yourself enough time for those other things. How do you juggle work? About? Oh, I see. Thanks for clarifying. Very good. How did you pick medical school in Israel, and how was your experience? Would you recommend it to others? 100%, Jasmine. Yes. I recommend the Caribbean. St. George's is a great school. I think Ross is a good school from what I've heard. University of Dublin. There's a lot of big schools out there. So if you're interested in a certain hospital, I would recommend typing in like UCLA internal medicine residency residents. And so you look at the residents and look at where they all went to school. And you can see generally, if that's the hospital you want to go to, those are probably the schools that you should shoot for, because they're familiar with those. That's more applicable to like international and DO schools, because schools tend to be more selective against DO or international schools, but by no means does that mean you can't, end up there and be a doctor still, because that's totally possible. I've had people from my international school end up at Harvard, like 2 in a year. So it totally happens. One went to Johns Hopkins. I think I went to a good school, but I don't think it's like that great. And it's still an international school. So it really just depends on the person as an individual. Okay. What extracurriculars did you do in college? I was in a academic fraternity. I was a RA, so like a resident advisor. So I had a dormitory of students of like 50, 60 students that I work with. I did volunteering. I did research. I did shadowing. I played guitar at my like religious, my place of religion. for a number of years. I did volunteering at a medical camp in the summer, which is really cool. You guys should look up that opportunity. Medical camps are really cool. More questions? Thank you, Una, Jasmine, Jennifer, Emily, Miriam, Jerry, Bella, Marie Espinoza, Danica. Thank you guys all for your questions.
I have one question, Doctor.
Yeah.
How important do you think research is? How
You gotta do it.
does it look?
You gotta do research. Do research, okay? So reach out to people. Usually, like, everyone's very kind and nice about it. Do research, but do it what you're interested in. I don't think you have to do it. I did it in like psychology. One, it was easier and it made more sense to me. And two, I was actually interested in it. And I spun it to be cognitive psychology. So it was kind of like medical psychology. So do it in anything that you find interesting. You don't have to do it in like chemistry or like lab table work, like wet lab. That sounds like terrible to me. Thank you guys so much, Jerry, Sam. Thank you guys so much. I'm glad you guys enjoyed it. Again, please, everyone, reach out to me on Instagram, please. I'm going to be expecting at least 15 people now, and I want a question from each of you. Okay, I'm doing this for you guys, so please respond. Okay, Bella, you're welcome. Okay, any other questions, concerns? Awesome, awesome, awesome. Love you guys. Awesome. Follow your dreams. Okay. Remember to be a human. Remember to, Sam, what's your favorite watch? I just got this MVMT. They're pretty cheap watches, but they're really beautiful watches. MVMT. They're very cheap. You can get them on eBay for very cheap. Okay. Good luck to you all. Okay. Reach out to me for questions. All right. You guys are great. You guys are going to be good. Follow your dreams. If you're not a doctor, you want to be a PA, you want to work in a homeless shelter. It doesn't matter what you do as long as you're giving back to the world. That's all that matters. Okay. Don't worry about being a doctor. Okay. Don't put so much pressure on yourself. Enjoy your lives. Okay, guys. Take care. Okay.
Thank you so much again.
All right. Bye-bye, everyone.
For those of you who are currently attending, we will post a Google link form on the chat soon. Make sure to take the quiz and pass with a 70% to receive credit for this session. And please try to use one email throughout all the sessions so we can keep track of your hours. And our next event is happening on April 12th with Haley Bourne. She's a physician in, I'm probably going to butcher this, otolaryngology.
You got it.
Yeah. Stay tuned for that. And thank you all for coming.